So good morning, good afternoon, dear viewers. Welcome to the third webinar series presented by Westminster Development Policy Network. And today we're very privileged to have John McDermott to present his slides and his discussion on One Health and the agri-food systems and its impact on human, animal, and environmental health in Africa and Asia. A bit background about John. John joined IFPRI in 2011 to lead the CGIAR research program on agriculture for nutrition and health. And before that, he was the Deputy Director General and Director of Research at the International Livestock Research Institute in Nairobi. And he has lived and worked in Africa for 25 years. So his research focuses on public health, animal health, and livestock research in developing countries, primarily Africa. He has led projects on zoonotic and emerging diseases in Asia and Africa. And he has a strong background in quantitative methods such as modeling, study design, and statistics. So he has earned his PhD in quantitative epidemiology from the University of Guelph, Canada, a master's degree in preventive veterinary medicine from the University of California, Davis, and Doctor of Veterinary Medicine from the University of Guelph. So after John, we have our own discussant, Evgenia Shalayeva. Evgenia is our newly appointed course leader for our MSc in Public Health Science program, mainly targeted for postgraduate students and working profession in medicine and related fields. So with that, I'll give the floor back to John. John?
Thank you, Bakram. And a pleasure to be with you, everybody. Let me just share my screen. Okay, can everybody see that? Good, okay. So I'll talk about One Health, but I'll talk about it in the context of agri-food systems, because I assume many of the people listening in or who will listen to the recording are interested in agri-food systems. So to look at the interface of that and go on from there. So what is One Health? One Health is a combination of human health, animal health, and environmental health. And why is this combination exist? It's not particularly a new idea. This idea has been a long time. It was very common in Russia to have this discipline called landscape epidemiology in the early part of the 20th century and mid part, looking at the emergence of hemorrhagic fevers, for example, from forests and things like that. So this strong interest in linking up kind of people, animals, and the environment linked to pathogens and infectious diseases. So the One Health focus is really on infectious diseases. And the One Health name is perhaps broader than that. And so, you know, One Health has been with us for decades. Why is it, I think, becoming more and more prominent now is a question. So one of the reasons is because the infections that One Health deals with are becoming more and more prominent in the world, and people are aware of them. They cause economic problems. They infect lots of people, and so they're great concerns. And they're of great concerns to the health community. You know, many of the zoonotic diseases, emerging diseases that take place in rural populations don't generate large numbers of people or large economic losses, but a lot of the One Health issues now are big global issues. So if you look at emerging zoonoses, about 75% of the new diseases emerging in humans are coming from animals. Um, and these are diseases in some cases with epidemic and pandemic potential, like the coronaviruses. And so we'll look at those a bit further in terms of emerging zoonoses and how they have evolved. But a lot of diseases are coming from animals. So that's one interest. Food safety has become very prominent in the last few years. The WHO commissioned about 15 years ago something called the Food Epidemiology Reference Group, which went to look at the burden of disease. It relates to all the other WHO work on global burden of diseases, and found and came out with a report in 2015 that found that the burden of foodborne diseases was very high, comparable to malaria, HIV, or TB. And these big three diseases get a lot of the funding of the global health community, and food safety is a similar burden. And most of that burden is in low and lower middle income countries, and it's among poor people, and it's related to pathogens in fresh foods that have gone bad. So that's, food safety is a big issue for the health community now. The other huge concern for the health community is antimicrobial resistance. This is a huge threat in many countries. A lot of frontline antimicrobials don't work, and it's not completely clear how important the use of antimicrobials in agricultural systems are to antimicrobial resistance in humans, but it's a big concern because there are large quantities used. And I use the word agriculture because we think a lot of the antimicrobials used in livestock and fish, but there's also a lot of antimicrobials used in crop production, including things like rice and citrus and things like that. So tonnages, probably the majority of antimicrobials used in the world are used in agriculture. We're not quite sure how important they are, but one of the concerns with antimicrobial resistance is that the resistance genes are very easily transmitted. They tend to be on plasmids and very mobile genetic elements that are easily transmitted between pathogens and even between pathogen species. So that's why One Health is a big topic these days. Now, this is a pre-COVID slide taken about 10 years ago when we were trying to convince policymakers and global funders, including the World Bank, that they should put more money into pandemic prevention. And so we had these numbers, and I guess they weren't convincing enough because I don't think there was very effective investment in pandemic prevention globally or in most countries. But certainly COVID has changed that dynamic a little bit, and people understand how important A, pandemic prevention is, although it's difficult, and then B, the importance of getting things under control and how important emerging diseases can be. Next slide is, yeah, so here's what do we mean by some of the emerging diseases that have been epidemics or pandemics? And some of them might surprise you. So I've made a listing of diseases coming from animals to humans, what the primary animal host was. One of the big issues in emerging diseases is that sometimes they'll come from specific species and be amplified in other species that live closer to people. So for example, Nipah virus, which is down here, is a virus of bats, but it got amplified in pig populations in Bangladesh and other places in Southeast Asia. And that was the way it got to humans because pigs lived closely with humans. So if you look, some diseases that might surprise you as emerging diseases, one is HIV/AIDS, which is I want to call it a pathogen, but a microbe of primates, in particularly in Africa. which probably spilled over to humans for several centuries, but never in big epidemics until we got to the situation where people were moving more broadly, where the densities of people in Africa were much greater. And that's when we saw HIV/AIDS spreading, both in homosexual and heterosexual populations, because the transmission pathways got amplified. You'll see a number of the emerging diseases are coming from bats, especially the coronaviruses, Nipah virus, but influenza will continue to be a kind of pandemic threat as well. So that just gives you a summary of some of the main epidemic zoonoses that come up. And some of them you might not associate that much with animals. All right. Now, because the focus is infectious diseases, not all infectious diseases are the same. And I've kind of broken them down into 3 categories. And this is a kind of primer for people who are not necessarily infectious disease people, just to give you an idea of the kind of range of diseases and how we look at them. So the directly transmitted microparasites, COVID is one of those. So they tend to be viruses, and they're transmitted directly by various means. And they're the easiest ones to model, the easiest ones to understand. There's a large group of indirectly transmitted microparasites, most of which are vector-borne. And so the vectors and the vector dynamics are very important in the transmission of the infectious diseases. You can think of malaria, a lot of the vector-borne viruses, like Zika, chikungunya, dengue. You can think of malaria. Those are kind of indirectly transmitted microparasite diseases. And then you have the macroparasites, which are larger parasites that are often transmitted by kind of complex pathways. If you think of cysticercosis or echinococcosis, they'll have multiple stages and multiple types of hosts. They'll rely on quite intricate transmission pathways. And they can be very important in certain local communities that have those things. So those are kind of 3 types of infectious diseases. There's been a great deal of emphasis that the public has seen through COVID in the kind of idea of how we model these and how we predict what's going to happen. And for the directly transmitted parasites like coronavirus, it's relatively easy. So the basic transmission, and you all hear of the basic reproductive rate or R0, relates to how many infected people, or how an infected person, how many infections they can transmit to susceptible people. So if it's greater than 1, then each infected person infects more than 1 susceptible, and you get an expanding population of infecteds and expanding transmission. If it's less than 1, then the disease starts to die out. And then we use various means to try and reduce that transmission between infected and susceptible, whether it's through social distancing or vaccination or whatever, and these can all be modeled. Now, we're pretty good at modeling infectious diseases. Some of the challenges are to do with things like social distancing and compliance and vaccination coverage and things like that, particularly when it's not homogeneous, where there are particular populations that don't accept social distancing or vaccines. And that's what's, I think, causing some of the challenges in predicting what's happening in COVID. But by and large, this is some of the easiest type of modeling to do. Now, one of the things about disease emergence is that we probably don't have a very clear picture of what's emerging or diagnostics. This gets better as genomic tools get better. But you'll see in this map, these are the reported disease emergence. And you'll see that the hotspots for disease emergence that's reported are in the United States and Western Europe. And I don't think that relates to the true incidence of disease emergence. There's probably more in other places. It's just where you're finding it. So so we have a problem of underreporting and actually understanding what's happening. So that's one issue. In Central Asia, I think a particular problem with zoonoses in the region is to try and quantify their economic effects. So the decisions about how government finances or disease control or any other kind of public program gets decided is basically on how big an economic burden is. And one of the problems with zoonoses is that they have multiple sources for burdens. So this data come from a study of brucellosis in Mongolia. And it looks at health benefits in people, the public health benefits, private health benefits from hospitals, agricultural benefits from controlling the disease in sheep and cattle, household income losses. And when you put them all together, it's quite a substantial burden, which wouldn't come across if you just broke it down by agricultural sector or health sector. And so this is a big problem for you in the One Health thing of looking at many of the zoonoses you have is how do you make the case, economic case for doing this? You really need to combine the different effects of doing that. And this is just one example. And there's articles looking at this available. The other, I think, important thing to remember, and I mentioned that that the global burden of foodborne diseases was very large, and that WHO and the health sector take this much more importantly. This burden changes depending on the stage of kind of food system change and transformation. So what we find is in very rural areas where there's short supply chains, foodborne diseases are important, but not that important. They get very important in countries which are changing their food systems very rapidly, which is happening in many of your countries. So you went from short supply chains, local supply chains, to supply that requires cold chains, that goes over long distances, that has multiple players. And it's easy for things to go wrong. And it often does go wrong when these systems are first being established, and the burden of foodborne disease goes up until countries get this under control. And for example, a country like Vietnam or India is in the red group where their problems are increasing. Whereas a country like China has had huge problems, and they are slightly decreasing now because they're getting more of their supply chain and food safety issues under control. So this is an important issue. And how do we help our populations make the transition from kind of traditional fresh food markets, whether it's for animal source foods or for fruit and vegetables, to more modern markets, which policymakers want? But how do we make those transitions and make them appropriately is a big issue for most countries. I mentioned antimicrobials as being a big issue. There's a lot of pressure, especially in rich countries, for antimicrobial use in livestock and agriculture production to be extremely restricted. Here's the antimicrobial use just in livestock, and you can see it's pretty high. This is from 2015. A lot of use for growth promotants and things like that. So a lot of pressure to reduce that. As I said earlier, we're not quite sure of all the impacts. In most places where there's big antimicrobial resistance, like in South Asia, most of it is related to how antimicrobials are used in human diseases. But this is a big concern, and it's a huge concern for all types of medicine, human and animals. If our antimicrobials don't work, that would be a huge problem. In all regions of the world in Africa, or all regions of Africa and Asia, the burden of zoonoses and foodborne diseases is greatest on the poor. And this is a particular issue in terms of looking at public health measures and things like that, is how do we combine services to the poor, water and sanitation, better food, better health services in a package to relieve that burden of disease. Now, I have, because I'm an epidemiologist, I've been very much involved in the kind of response of IFPRI and the CGIAR to COVID from a food systems perspective. And, you know, we've had lots of food crises in the past. We had a food price crisis in 2007, 2008, where the price of particularly cereals like rice went 5-10 times higher, and it caused a big problem in importing countries that were bringing in wheat and rice and maize. COVID's been different because it hasn't been just a supply side shock, it's been a demand side shock. So basically the problem with COVID is it disrupts the way that people interact and systems interact. And so that breakage of connections has caused all kinds of disruption. So it's been a big health shock, and that's continuing and getting worse in some places. And how that will play out over the next couple of years is going to be very interesting. But because of these other disruptions, both to the supply of food and to the demand for food, remittances in your region of the world, incomes are all negatively affected. We get this economic shock as well. And the two are interrelated. So in the beginning of the pandemic, people were very nervous. And so there was a lot of lockdowns in countries where and really done, in some cases, quite indiscriminately. And when we looked at the outcomes and their impacts on GDP and on agricultural GDP, we found some pretty dramatic decreases. So economic activity in a lot of places stopped quite a bit with severe lockdowns. And so this is a graph of kind of during the period of the lockdown, how much of a reduction was there in GDP and agricultural GDP. So this certainly highlighted the interplay between food, economics, and health that we haven't seen before, or haven't seen for more than 100 years anyway. We haven't seen that anybody has repeated these severe lockdowns in recently, even under severe strain. They haven't gone to complete lockdown anywhere. They also show the importance of policy coordination across different sectors, which will remain a challenge. Now, one of the things that always comes up when you have a pandemic or emerging disease is, how do we prevent the next one? How do we prevent emergence? And I guess if it was easy, it would be done, and we would be clearer in what we can tell people to invest in. So what are some of the factors that are leading to disease emergence? Well, one of them are that we're breaking interfaces. This is the idea of landscape epidemiology that was common 100 years ago or more, and continues. And a lot of the emerging diseases are coming from forests, they're coming from bat caves, they're coming from places where animals and humans don't go, but there's been more trade. There's chains of wildlife meat and other things that come from these places. People are invading forests. So we're seeing greater interaction with diseases which are pathogens which are not normally coming. So that's one interface. The other is we've seen a huge increase in the global population of animals, chickens, pigs, cattle, not less cattle and sheep, but also those, but more, especially chickens and also pigs. And so they are great at kind of amplifying, transmitting diseases that often wouldn't become epidemic I can recall in the avian influenza outbreak around 2006, there was quite a bit of concern in Africa that this would become endemic, avian influenza, and it didn't because the poultry populations were too small. They weren't dense enough. Whereas it became endemic in places like Indonesia because those populations were denser and the disease could be transmitted. So that's another feature. And then another feature on emergence is we're all moving around. So it's easy to move coronavirus from China to New York City or London. That's where we had the initial outbreaks because people are moving and it's hard to get them to stop. And so this global interchange is happening, and it's happening in your region as well, and in a sense that hasn't happened before, and it's certainly the case. So this is just to highlight the density of populations of animals, and this has been traditionally in East and Southeast Asia, but it's spreading in the rest of Asia and Africa now much more significantly. I just wanted to highlight in this slide a recent paper by UNEP and the International Livestock Research Institute on pandemic prevention associated with environmental health that you might want to look at. And then from a livestock or agriculture perspective, here are some ideas about what we might work on in terms of investing in One Health, from the interface of human diseases, collaboration between sectors, which remains weak in many places, thinking about the role of women and vulnerable populations, managing the livestock and the environment, and for example, the invasion of forests, make sure that we treat our animals well so that they're healthy, ensure food safety, and control antimicrobial use are some of the main features I think that we'll see from the livestock and fish populations going forward. I'd just like to close off with a slide about what I see are some of the unfinished challenges, the things that we need to address that we're not very good at so far in the area of One Health related to agri-food systems. So I think in specific circumstances, we're pretty good at linking human and animal health and sometimes environmental health. In specific communities, we understand where there's pastoral communities or livestock communities where we have brucellosis. I gave you the Mongolia example, for example. We can get to the bottom of that and know how to control it better. Some of the emergence of hemorrhagic fevers from forests, we can figure out how to do those. We can get better around outbreaks and events, but these are all at kind of small scale. And so the broad prevention of epidemics and pandemics, the early warning systems, the kind of innovative screening systems, warning systems that we get, for example, through social media and stuff. There was some great systems that got discontinued just before COVID that were available to alert the health community to watch out for certain things. Those need to be rebuilt. So we've had good experiences, but we haven't built up the infrastructure to do these at global and regional level. Our capacity is still much more responsive than preventive. That's understandable, I think, but it's a problem because we know that prevention, if we can do it, is going to cause huge, or prevent huge economic losses and huge losses of human life. The other thing is that one of the challenges for One Health is that the world is changing quickly. We've got more urbanization, intensification, habitat destruction, pathogen change, interactions, disease emergence. And we need to think ahead, and we need to look at some of the root causes of this dynamic change and how it works. We're seeing the emergence, for example, of a lot of viruses which are transmitted by Aedes mosquitoes, and multiple viruses can be transmitted. So we're seeing dengue and chikungunya expand their range, for example. So this dynamic change is quite dramatic. finally, we need to understand better the trade-offs and the economics, because at the end of the day, the investments, the public policy are driven by ministries of finance, ministries of planning, and not necessarily by the agriculture or health sector ministries. And so it's important to be able to make the economic case, the quantitative case for what's going on. So let me stop there. I think I've done okay in keeping to a reasonable time so that we can have discussion, and to give Evgenia time, I'm really looking forward to your perspective. So back to you, Bakram.
Thank you, John, very much. Very interesting. Always, I learn new things on every Wednesday. So to Evgenia, please. Yeah.
Hi, dear John. Thank you very much for a wonderful presentation and very impactful talk, because we should talk a lot about zoonotic diseases. And if we just go to the history of worst epidemics in our life, back to Ebola in 1967 with 40% death rate. And then if we look at the pattern, 2002, SARS in China, 2003, H5N1 bird flu. Then 10 years later, another China outbreak and H7N1 bird flu. And in 6 years, we have COVID-19, which basically lead to not only health crisis, to global crisis, economic and finance crisis. So, and here the discussion, because I am a medical doctor and public health professional, I want to bring a key component of public health here, because in our society, we address health issues after they occur. So, and look back to all these pandemics, and now with COVID-19, we are dealing with the health issue, basically with from scratch. And public health approach is when we go upstream the problem, trying to prevent the next pandemic. And looking forward, we might expect it pretty soon. So what do you believe, how we can break the drivers of zoonotic pandemic risks to not prevent, but at least to make it, to be prepared for us, to decrease the chances for pandemic and crash all over the globe?
Good. So let me start with, I guess we're moving into the discussion. So shall I start with that? Thanks very much for your comment. So a few things. Some of them are not necessarily pandemic specific, and then some of them are pandemic or epidemic specific. So one of the things I think we've learned from COVID is that we have huge problems with our vulnerable populations. Both in terms of the spread of disease, and it's impossible in urban settings with lots of poor people to control infectious diseases, because people can't socially distance. They can't. And we've seen a lot of problems with multi-generational families and older people getting infected. So there's more we need to do. We need to really rethink the basic needs of vulnerable populations. And if you think about public health, the great improvements in public health and life expectancy have come through better food, cleaner water, better healthcare, and vaccines and antimicrobials too, yeah. But so this kind of package of basic needs and how we protect our vulnerable populations has really hit me during COVID as being something we need to do. And that's a crucial kind of basic thing that would help us. Epidemic diseases. These are also populations that are susceptible to obesity and non-communicable diseases, because they have much less healthy diets than richer people in most of our countries. So that's the kind of general public health message that I'm sure Evgenia will appreciate. Then the more specific kind of disease, infectious disease stuff. You know, there's been a lot of interesting things done around early warning systems. You know, there's all kinds of social media, there's all kinds of crowdsourcing of information that you can get, which tells us what's happening. You know, if we can find out that there's an outbreak somewhere, we don't really need to know what it is. And initially, at least we know something's happening is useful. So Canada, for example, was funding a program with the WHO on kind of crowdsourcing of information. It was pretty effective, but it got closed down. It arose because there was a big SARS crisis in Canada in 2003 that came from China and East Asia. And they reorganized the whole public health agency, and they put in some of these early warning systems, and they just kind of ran them down, and it stopped about a year before COVID. And so, yeah, I guess we got to learn that we got to pay attention to these things. So early warning is one. We're clearly getting better at diagnostics and faster. And I think the kind of genomics analysis, the, you know, analysis of sewage, analysis of, you know, kind of metagenomic analyses are very useful for kind of screening pathogen populations. We use them a lot, for example, to look at antimicrobial resistance genes in sewage and water. I think those are good things to do. We could also do multi-genomic screening of animal populations better, particularly for populations that we think amplify certain viruses. For example, pig populations are a good screening device for bad viruses. And then just there's a lot more of the basic biology of the emerging pathogens and what happens, and understanding what are the kind of genetics of emergence and pathogenicity that I think we're getting a much better handle on in COVID. And then the other thing is more on the mitigation side. So what we've seen in the past is that countries that had good basic infectious disease control, particularly in East Asia, like Singapore or Taiwan or Korea, they're good at wearing masks. They can do social distancing for a while and continue working as normal. The Western countries weren't so good at that. Hopefully they'll be better at wearing masks and doing things like that in future. And then I guess the other massive breakthrough is how quickly the vaccines have come up and running. It's just a triumph. And I hope we can take advantage of it. So those are some points. I don't know whether there's things, Evgeny, you want to add or other things you see, but those are some for me here.
I actually want to talk about another public health program, which called global warming or climate change. Because nowadays, those ones who believe that this is crucial and important can see the pattern that global warming brings animal or wildlife very close to humans, and the contacts are increasing dramatically. And we also can see that we have agricultural intensification, and we have demand for animal protein as well, and urbanization and industry which cannot stop. And this exploitation of wildlife and very close, we live very close together. We see that the wildlife nowadays can enter the human being environment pretty easy, and the contact may occur at any time, which might bring to another pandemic as well. So what is your opinion about climate change and how we supposed to act to, because in my opinion, dealing on the policy level within countries, this might decrease or the chances of a very high burden of zoonotic pandemics in the near future.
Okay, thanks. So yeah, we're kind of living at the boundaries of or beyond the boundaries of our planet right now, and it's causing all kinds of stress. So I guess one of the things you can expect is more frequent crises and more joined up crises. And those will be disease crises, those will be climate crises, those will be perhaps other environmental crises, financial crises, etc. So expect multiple crises and more frequent crises in future that we're going to have to deal with. And as we can see, they get quite joined up. So some people in health think that climate change is a big deal. I work a lot with a group at the London School of Hygiene and Tropical Medicine who are very interested in climate change and do a lot of work on that. Clearly, there's a lot of direct effects of climate on heat stress, and we see a lot of problems there. But the bigger ones are on these basic needs. So food, water, it puts all those systems under incredible stress, the climate. On the infectious disease side, I think the most immediate effect we've seen beyond the kind of planetary boundaries, things like increased livestock population density and things like that, is the change in distribution of vector-borne diseases, which is quite an important thing. So, and I mentioned Zika and chikungunya and Nipah, or not Nipah, dengue, as some of the viruses which have really expanded their range. And a lot of this is climate related. And vectors, get more competent in different ranges, and they can expand their ranges. So we've seen lots of susceptible human populations getting new vector-borne diseases because the vectors are able to move into northern climates. This will be a big issue in your region, where vector-borne diseases, and what that does is, until there's a kind of endemic stability established with those diseases where the population gets used to them, and we get a lot of these epidemics happen when we get high dose infections, and then we get lots of sick people or animals, and then they pass on high dose infections. So once it gets established and there's some endemic stability, then there's a kind of population stability that happens. But right now we're seeing vector-borne diseases in particular moving around a lot, and that's a huge issue.
Thank you to Evgenia. John, I know you need to go, so one last question, and then we will close this webinar. In your last slide, you spoke about trade-offs. So when I just like to probe at this, how you start thinking about trade-offs for very developing nations. Is this really a trade-off? I mean, you look at the situation in India, and you even look at the situation in Uzbekistan we had last time. I mean, we cannot keep the country under lockdown for months. That's not possible, because people will run out of food, water, and this economic sustenance is very important. So I'd just like to get your thoughts, how you think about trade-offs when you think about poor or developing nations. What do they trade? I mean, you know, it's even vaccines. I mean, if you look at the vaccines, the developing countries are just getting the vaccines. So, and the Western countries, or those who could afford or who developed those vaccines, are already vaccinated. So yeah, so I'll stop here. You're muted.
Specifically for COVID, I think it showed us how we can't totally lock down economies. It just, especially for where there's lots of, as you described, where there's lots of poor people whose basic livelihoods depend on things, we made it worse for them, not better. And so that's an important trade-off. For example, if you look at the food system, in a lot of countries, the food services went down by 90%. Those, you know, those are important services for people, and important income production and things like that. So we just can't, we've got to be smarter about that. And, you know, every country did, well, that's not true. There was a lot of variation in what countries did, but, you know, often the lockdown isn't really fit or tailored for the country. So we need smarter social distancing, smarter control measures, but yeah, we we can't go through serious lockdowns. So that's on like lockdowns. On the trade-offs, I meant more other things. So, for example, for forest communities in Africa or Asia, there's been a lot of economic benefits from being able to sell bush meat, so meat from wildlife and other wildlife products. So that's one thing. Do we just ban that trade? What does that look like? How do we judge the risks and the benefits of that? Most of the benefits of wildlife around bushmeat are for domestic consumption, for local consumption. They're not for export or something like that. So what do we do? But how do we support those communities? If we can't look after people's basic needs, then they're going to do desperate things. So I think that's the other thing. You can't expect people to just sit there and die. They're going to do what they do. So we've got to be smart and work. And I think work with people, work with communities up that game. And the public health groups know this the best, that we have this thing, it's knowledge, attitudes, and practice, and a lot of it's around behavior and behavior change, and so that's crucial for that. So yeah, working with communities to understand what their trade-offs are, and some of them are economic and some of them are others. There's big trade-offs around whether we're going to continue to increase livestock production under what circumstances where. And those trade-offs relate to greenhouse gases, they relate to use of water and land. In some cases, we should use more livestock because we're using pastures, and we shouldn't be growing crops on those. But we should probably keep the livestock out of forests, for example. So those are some of the issues. And then just how much we want to intensify them. I mean, the most efficient kind of chicken production or pig production is very intensive, but it's not very ecologically sound. And it's a disaster when we get either human or animal pathogens going through pig populations. African swine fever was just uncontrollable in your part of the world. And so, yeah, we got to think about what are the kind of limits to the densities and the intensity of some of these things, and think more about sustainable intensification. To look at those trade-offs, we need better numbers on costs and benefits. And the joined up numbers that I talked about, where we add up the health impacts, the agricultural impacts, the social impacts, and put them together. So that's kind of what I mean. Thanks for asking me to explain that, because I think that's a very crucial issue.
Yeah, just to follow up to this, you mentioned urbanization. So would urbanization amplify these trade-offs, or would it help solve some of the problems? Because I think, I don't remember the number, but by year maybe 2050, more people will be living in cities rather than rural areas. So perhaps the technology will get better. Preventive things you mentioned will get better by then, and the impact on everything you mentioned around it, around people, will be much more mellowed. I don't know what the right word to use, but what do you think this trade-off between urbanization and the things you mentioned?
So it'll make it different. I don't know whether it'll go up or down. The thing with urban settings and One Health, infectious diseases, is that it changes the dynamic, and the environmental health aspects are a lot around urban planning. So there'll be big issues with sewage, there'll be big issues with rodent control. So there'll be different types of issues, water supply. I think if you want to look at experiences of countries that have looked at the public health challenges of urban areas, Latin America is a very interesting thing. It's the most urbanized of the developing regions of the world. And they've put a lot of effort into urban design, into looking at urban issues. On the kind of foodborne disease side, as we lengthen the food supply chains, have more middlemen and things, that it gets harder to control food safety for perishables. We need good cold chains and things like that. What tends to happen is in transitioning countries where cold chains and supermarkets and other things are just being developed. There's a lot of mistakes in the beginning, and it actually gets worse before it gets better. So if you think of China, for example, they had huge problems in food quality and food safety. They're starting to get those under control now, but it's just so hard to manage in the beginning. Things are expanding fast. Things are moving around, and it takes a while to get the quality control. Often, I think I showed a slide with a supermarket in Vietnam. There was a picture, it was a glass case. I find that many of those glass cases are more like incubators than refrigerators at the beginning, and it actually makes it, we find supermarkets are worse than the short fresh food chains in the beginning. So those are other issues associated with urbanization.
Okay, so John, thank you very much. Again, I understand you need to go in a few minutes. So I'd just like to remind our viewers, thank you very much for joining. Please join us next time for another talk by Patrick Gall from the University of Bath. And I would like to thank our co-organizers, Kamjan Kram from IFPRI and Karen Jackson from the University of Westminster. With that, colleagues, thank you very much and have a good day.
Thanks, everybody.